And moving on now, and experts at the University of Nottingham have received £2.4 million in funding to develop new non-invasive brain stimulation interventions. They'll be for patients with a wide range of health conditions, from depression to schizophrenia and Tourette syndrome too, using ultrasound and magnetic stimuli that they hope will be more effective and cause less long-term harm to their patients. And here to tell us all about it is Professor of Neuroinformatics, Marcus Kaiser. Thank you so much for joining me. I hope I've said that right. Neuroinformatics. I've never even heard of that. Yes. Amazing. So tell us more about this. Why do we need these non-invasive processes?
Yes. So we had a survey with around 800 participants, healthy participants, and also patients suffering from brain and mental health conditions. And we were asking them what kind of intervention would they prefer. And we found that people really prefer non-invasive technologies. There's a lot of talk with Elon Musk's implants and so on, but people don't like them. Even for cochlear implants, only 7% of patients have cochlear implants. So there's a clear preference for non-invasive technologies. And one of those technologies is using ultrasound for brain stimulation.
So you've brought something with you, and this shows kind of how the non-invasive technology might work.
Yes, yeah.
So it's literally like a little headset.
Yes, so there are different technologies. The technology that we are developing is a bigger device where we get ultrasound through the skull into the brain. But this is a device that could be used at home.
Wow.
So you have something like a headphone, you fixate this in the ear, and then you have ultrasound coming out. And this is stimulating the vagus nerve around the ear. And in healthy participants, it leads to better sleep, and it leads to reduced anxiety for anxiety patients. So this is basically on the market, you can buy it online. But what we are developing as part of the program grant is looking at different conditions. We're looking at depression and schizophrenia, and we try to use ultrasound and magnetic stimulation to help patients.
It sounds incredible. So is the aim of the study, because it's a long study, a 5-year study as well, is the aim of the study to stop people needing the invasive treatment or to find out what the non-invasive treatment does?
Yes. So the goal is to look at parts of mental health conditions that are not well addressed at the moment. For example, if people have schizophrenia, you already have pharmaceutical drugs for hallucinations. But what patients also report is cognitive impairment. For example, they have problems with working memory, and this is inhibiting them to get a job or to have a higher quality of life. And we're looking at those cognitive changes we see in patients, and we want to address this gap in the current intervention.
And the things that you do at the University of Nottingham are just incredible. So you're leading the study. It's got a fair amount of money behind it, £2.4 million, a 5-year study. What happens next? What are the next steps? What are you going to do for 5 years?
Yes. So the first step is that we are developing novel approaches, how to use ultrasound, how to use magnetic stimulation. We will test this in healthy participants in the first 2 years to see whether we can improve cognition. And in the last 3 years of the 5-year grant, we will look at patient cohorts. One is depression and schizophrenia, and the other one is Tourette syndrome.
And is it difficult, because if you're in the testing period of these things, to get people to kind of agree to test?
Yes. So that's an interesting bit about ultrasound. When we ask people about their preferences, when they hear ultrasound, they just think about pregnancy scans.
Yeah, of course, yeah.
So if it's safe for pregnancy scans, it's safe for brain stimulation as well. But what we already know from large studies with hundreds of participants is that we have fewer side effects than what we see for other interventions. So for implants, the side effect is you have to open the skull in 100% of participants. If you have magnetic stimulation, a third of patients have side effects like a headache and skin irritation and so on. For ultrasound, it's only 3% that have any side effects. So it's much more tolerable for patients and participants.
And I guess one of the questions is going to be, when will this be on the market? When do you hope that this might be being used for actual patients?
Yes. My hope is that within the next 5 to 10 years, this will be used in hospitals worldwide as an intervention. But it's early stages at the moment. We still have to find out the best approaches.
It's so interesting. If people do want to find out more about the research that you're doing, how can they find out more?
They can follow me on X or Blue Sky. It's Connectome Lab. Or they can just Google my name, and then they can find out more.
Do you know what? It's so interesting. I love hearing about the work that's going on at the University of Nottingham. I also love the fact you brought a little brain with you. Is that like a half brain?
Yes, so you can see the outside of the brain and then the inside of the brain. And the benefit with ultrasound is that we can directly go to deep brain structures that we know are involved in lots of mental health and brain health conditions.
It's amazing. Professor Marcus Kaiser, thank you so much for joining us.
Okay, thanks for having me.
So interesting, isn't it? Right.